So good evening, everyone, and welcome to this global support group meeting. And we've had patients I know from London, US, from Tanzania and Kenya and all over India as well. Today I have the pleasure of having Dr. Shubham Pant, who is an amazing oncologist. He is leading in research at MD Anderson Cancer Center in Houston. And he's found the time to write a book on food matters. I have read the book, so I have my own questions and thoughts. But Shubham, what made you write it? I mean, this is an amazing accomplishment to write it for us and for our patients as well.
Well, thank you for that question, Bhavna. And as you know, I was born, brought up in Delhi. And I went to Maulana Azad in Delhi, and then I came to do my residency and fellowship in the US. And one of the differences I found was when I was in medical school in India, we really, as physicians, we really not taught about diet, nutrition. We taught about medical, medicine, which is obviously very important. But as kind of treating patient as a whole, that means if we really just focus on a certain aspect of the patient care, I think it kind of leaves behind the way we call it is a holistic aspect of the patient, in which we look at all the different parameters what the patients are going through. So when I kind of started talking to my patients, when I became an oncologist, I started talking to my patients about diet and nutrition. And in the US, thankfully, we have time to sit down with our patients and talk to them. And because of my father, Colonel C.S. Pant, who's got a very active breast-driven radiology practice in Delhi, so he always calls me and says, "Hey Shubham, isse baat kar lo, koi mere dost ko usko your cancer huआ, why did you talk to them?" And whenever I used to engage with people, I just realized I was talking about nutrition, and like, this is your chemo, this is what you're going to go through, this is your hormonal therapy, and nutrition was really not talked about, which I think is really important. And it was kind of still in the dark. So I started looking at nutritional sources, about the data behind it. And a lot of the nutrition is just, somebody gets up in the morning and writes a blog on their own private blog or sends a WhatsApp message or something, so it's kind of, the issue is that there's a lot of misinformation out there also. So that kind of also is a challenge for oncologists, cancer doctors like us, to kind of relay that information, which is data driven, which has some science behind it to the lay public and to us, because we really haven't been taught that in medical school. So, the more I looked, the more I kind of became interested, the more I read, and, and the literature was all in the Western literature. A lot of the food things were, with the very meat-based and, other Western foods based, pastas, etc. And so I just kind of decided first, basically it just came, I like eating, I'm a foodie. So it came through as more like a diet, like a book of a recipe book. And I was talking to chefs and, friends and everything. And then when I started writing it, it became more into just more than a recipe book. So as you know, then we started writing about prevention, about the data behind prevention, and how India's undergone a change over the last 2 or 3 decades. And then obviously what you can eat during cancer therapy, and then survivorship, which is very important because, as you know, a lot of patients with breast cancer are survivors. And so, what do you do after the adrenaline rush has gone, chemotherapy stopped, and then what do you do after that? And how do you really, live your life as a survivor? And those are very, very important aspects of patient care. So that's a long-winded way of saying, what made me write the book. It was actually very patient-driven, and just to add a little bit of, data behind food, which is a very, it's just not well, the research has not been presented, I think, well in that. It's just more thoughts and, what people just think or have biases. So this is tried to be like unbiased. We just, gone with the sciences or gone with the data. Is we haven't tried to, bias one way or the other. We've just kind of looked at science in a very agnostic fashion, not in, and then just said, okay, this is what the science is, and we've just traveled towards where the science is.
I think that's what I loved about the book is that, you have references, you have actually done research as if you were writing a paper, the way you've written the book. So one thing is that in let's say in the West, the breast cancer incidence is, I would say, 1 in 5, 1 in 8, depends on where you live in. In India, it is like 1 in 20. It used to be 1 in 35, 36, 1 in 100 in the villages, but it's come down to 1 in 20. So the incidence, is the new patients diagnosed with breast cancer in the cities is increasing. And I know a lot of our patients, I can see them in the group as well, are in their 30s and early 40s. So do you think it's all related to, like you said, there's been a change in our food habits over the decades? Do you think that may be one of the factors and we can do something about it?
I think it's part of a bigger puzzle, Bhavna. So I think it's just not one thing or another thing. I think it's part of the bigger puzzle. So with breast cancer, as you know, one of the biggest things is family history. Obviously, in the younger patients, BRCA1, BRCA2, that's important. Other variants also are there, but those are the big ones. So part of it is that. I think part of it is diagnosis. We're just diagnosing more people. More. Even like just coming out, getting mammograms. Access to care. Then we do see the younger patients in India, but then we do see more. There's been demographic shift in India. That means people are living longer, as some of the cancer, including breast cancer, is a disease of the aging, and that diet and lifestyle, more importantly, does have something to play with it. Again, what we eat, the rates of, as we say, rates of obesity are kind of going up. So that's a general, so I think it all comes together to kind of form this mixture in which we're just seeing a little bit more increase in the number of cases of cancer, essentially. So it's kind of not just one part. So food is definitely there, but it's a piece of the puzzle. So I think along with that, what we are doing to kind of, the biggest thing is, I'm actually glad people are going and getting checked out, because cancer caught early is curable, as we know. Yes. But stage 4 is not. So I think it's a good thing that people are going out, getting tested earlier, and we're catching them a little bit earlier. So
I think, yes, COVID did put us back quite a bit the last whole year. I think I've been now trying to say, don't let the fear of COVID be counterproductive. You must go for your mammograms. You must go for your tests. If you're due your annual tests, you must. Most of the patients I'm seeing are already node positive. They've felt a breast lump which has been painless, but they've not gone and taken advice. So I think it's very important that we change that dynamic as well.
I think that's very important, Bhavna. And we are seeing it in Anderson, sorry to interrupt you, but we are seeing that in Anderson also, that patients are coming in, young patients who are coming in, I felt this pain like 8 months back, but I really didn't want to go out and get tested. And so sometimes, to avoid one issue, something else can come up. So if you're feeling, not feeling like you weren't feeling normally, and, there's something which is going on which is wrong, or there's something which is not wrong, but something which is not right, you should definitely not wait for that preventative checkup, which is very, very important.
Absolutely. So, we have a question there that, what about Indian herbs like giloi, haldi, amla? So I can see one of my dear friends now, and a patient, I remember the first time she came to me, she was on industrial quantities of Ayurvedic stuff, and I could not start chemotherapy for neoadjuvant triple negative breast cancer because her liver functions were through the roof. They were not normal. So I think one has to, what is your take on this? My take on this is, that don't take it in industrial quantities. A little bit is fine as part of diet. What do you say?
I think it's all, you're exactly right. So, this is obviously something that we really looked into. So the theme of the book, and people who read it can see it during that everything in moderation. So just as in life, we do it, everything everything should be in moderation, essentially. So when we look at and there's actually a paragraph in the book saying, don't supplement your food. That means all this, what we're talking, Glory, amla, haldi and everything as part of your regular diet, which is happening as part of a regular Indian diet is great. And that should be incorporated, and but if you go out and buy, and actually at MD Anderson, we've done, this is in about a decade back, turmeric in the lab, again, showed some cancer cells death and everything. But when we look at turmeric in a way, when we combine it with chemotherapy, patients just couldn't absorb it well, a lot of GI trouble and everything. And you're exactly right. We have patients who are on a lot of supplements out here. And the issue is when you have like neoadjuvant therapy for breast, you're going for a cure here. You're trying to chemo, then resection, radiation, but so you're trying to go for a cure here. So so that we've seen those supplements sometimes interfere with that cure, essentially, and they hamper our ability to give chemo, because a lot of our chemos go through the liver. So nothing in excess. I know there's, people say there's a lot of data behind it and everything, but I can tell you that when one of our chemotherapies that we give for breast cancer, Taxol, people always talk to me saying this is all Western medicine and it's all bad, but it's really not. Taxol comes from the Pacific yew tree. So it's from nature to allopathy. So not all allopathy is bad. So you should take it all together. If you have a curable illness and which can be cured with chemotherapy, resection, then just decreasing that would decrease your chances, I think, of getting a cure. And that's really that's something that you should avoid against. But when you're looking at centuries of herbs and food, and yes, definitely you should incorporate into your diet. But just taking industrial this thing of it, I think that really hampers, that can really challenge the outcomes and everything. And what we've seen is that all this, whenever we look at these stories and everything, they say, oh, look, there's something in a paper somewhere. Like, I can always find an obscure paper to quote for anything. But you have to look at papers which have been peer reviewed. Data is not the same as, Bhavna. This is hard for us also as oncologists. When we look at articles, that's one of the things which is taught to us. It's very hard to read that article and say, make your own deduction based on, what the authors may have biases. So, I can quote some obscure paper from some journal somewhere, it's published somewhere, which I can say, oh, look, it helps me further my argument. So that's not what we're trying to be. We're not trying to be biased here. We're just trying to be agnostic to the data. So when I say something, I'm not saying Dr. Shubham Pant thought this at night and now I'm going to try to find an article which proves my point right. That's the trouble. I think one of the things in today's world is that we have an opinion and we go and find data to support that opinion. And then we unleash it on some social media or something. And everybody's like, oh, you're right. But it's not all data is the same. You just have to be agnostic. You have to look at the whole date. You have to this is a vast subject matter. There are hundreds and thousands of articles about this. You have to look at it and the entirety. So you've got to be very careful before you really go. If you're going towards extremes, I'm not a big fan of that. And you really have to be careful, because then, like you said, it really can delay treatment, and come in the way of curative therapy.
Yes. So we have some questions, but I just wanted to ask you one thing, the diet and food during treatment and after treatment, during what we say survivorship. So what would be your pointers for a lot of our ladies who are undergoing radiotherapy, chemotherapy? And so the thinking changes after that, because we know chemotherapy affects our taste buds, sense of smell and everything. So what would be your take on both these scenarios?
Yeah. So Bhavna, when I started to write the book, I just didn't want to write it from an oncologist or physician's perspective, because so I talked to a lot of survivors, a lot of patients, and Indian patients of my fathers, who are in breast cancer groups and everything. So I really try to learn from them about what they went through, because we do talk to patients, but again, we talk to them about chemo, then I talk to them about diet. But again, when you sit down with them in a non medical setting, just in your in your house or something, or in my father's house for this, we would just sit down and talk. How were you diagnosed, what was going through your mind, how did you think? It was very interesting. I actually learned, as a physician, I learned what patients actually go through that process, essentially, and how they deal with it, and emotionally, psychologically, how, what goes on. What I noticed was that everybody's journey is very different. With food, it's a very personal journey with everybody. So some the taste got too salty, or the taste got too sweet. So some got that metallic taste in the taste buds, some lost weight because they get some infection, some gained weight, so kind of it's all over the place. So it's very personal. So you have to you can't choose one size does not fit all in this. It is really truly has to be personalized to what you're going through. But what the book does, it gives you some general guidelines of what you can do. So when it says about, it talks about cachexia, which is just losing weight and just becoming just not being able to keep your nutritional needs up. But it also talks about you can actually gain weight during the therapy. So just people say, because they say, oh, don't lose your weight during chemo, just don't start stacking on the on unhealthy stuff, right? You should kind of maybe focus on the fruits and something else which is more healthy snacks, almonds and things like that, which you can use to maintain your maintain your weight. So it's very personal in a way for everyone during cancer therapy. Now for things like constipation and, for things like nausea and everything, there are things out there, increasing the fiber, what you can do, kind of having lighter snacks and everything. A lot of that unfortunately needs medical intervention. So we give, therapies before chemo, which decrease nausea. And I think that really helps. Now coming to, that's during therapy. So that's very important, but it's very personalized. Now coming to survivorship, when we looked at it, the big themes, when we look at survivorship, that means after your cancer therapy, when you're on hormone therapy, as a lot of breast cancer patients are, or you're just, or you don't have a hormonally driven cancer and you're just kind of, gained weight, or, what can you do during survivorship? So one of the big themes is, which is actually data driven, is you need to keep your friends and family very close to you. That means, the pandemic obviously has shifted some of those alignments, but support groups, exactly the way, you run them. And that really helps. So, and then physicians being involved in that, just like you, Bhavna, because what we've seen is there's data saying if the physician tells you, I want you to walk, 3 times a week, or I want you to walk 30 minutes every day, or I want you to look at your diet or think about a diet, that really, that really helps. That means patients do tend to follow that. If you just tell them, give them a folder saying, here, it's the folder. But if you actually talk to them as physicians saying, hey, maybe you want to walk a little bit, even that little nudge really helps patients. And what also helps is support groups who can kind of, this kind of community of people who've been through the same shared experience, and they can help guide things along. The other big things are that exercise is big. And exercise, I don't mean you have to run a marathon or, run the 100-meter dash or something, right? But exercise, what we mean is just even brisk walking, half an hour every day, just some walking, get out, walk around, play some maybe, light sport. If you like playing some people like playing tennis or something, playing a little bit of tennis during the week. And the biggest thing is maintaining your weight. You really have to watch that if you're, especially in breast cancer, if you're going towards obesity because of the hormonal changes, as younger women going to menopause, and that can actually, cause its own, kind of set of issues and everything. So you really have to watch that. So survivorship is very important. So your journey doesn't stop just with, I finished the chemo. Survivorship is as important or even more important when you go into it to decrease your risk.
So I think that's very, very important. I actually prescribe weight-bearing exercises for most of my patients. And during chemo as well, I insist that, listen to your body, but, try and see as much exercise as you can do. Because I don't know what your experience is. My experience has been that exercising does help. Keeping active, working, during chemotherapy just makes the journey slightly, it may not be possible for some of our ladies, I do understand that, but exercise does help in actually combating tiredness more.
You're exactly right. So it does with fatigue and everything. And again, you're right. We're not trying to, say that, oh, you didn't do this half an hour a day. So that's not the case. It's you should do whatever you can do. But knowing that can have health effects. Again, some people do get really sick during therapy and everything, and they're not able to get out and do much. And that's fine. The days you're tired, you can sleep. But the days when you have some good days, you go out and do, you go out and do the exercise or something, so you have good days, it's all, one of my patients told me, he said, we learn something so much from our patients. And I just remember this patient had stomach cancer, gastric cancer. And he told me, and he was going through a rough patch. And he said, Dr. Pant, life is full of peaks and valleys. So he said, we enjoy the peaks. So when you're feeling well, you go out and then you grind through the valleys, essentially. That means you're kind of in the valley, you're not feeling well, and you kind of try to come up essentially from that. So that's important.
Absolutely. So we have some questions here. Can dairy products like milk, paneer, and curd be taken after treatment? And I think maybe you could tackle dairy and sugar together.
I think I'm getting some this thing, but did you say dairy products, Bhavna? I think dairy products.
Yes, paneer and paneer, milk, and curd.
Yeah, I mean everybody. Yeah, short answer is yes. You can have is good to kind of and especially paneer and everything. It has some protein in it and everything. I'm a big proponent of yogurt, as part of your daily diet, and as and after that. So again, there's a lot of misnomers out there. Don't eat this, or this will come back. Don't eat that. I mean, but you have to really look at why do they say that? What is the what is the reasoning behind it? Where is the data? Everybody keeps on sending me these messages all the time on on what you should not eat and everything. I think there's a whole factory of people educating people on not to eat. I think you can eat everything, but in kind of a moderation. That's the main thing. You kind of make it part of a healthy diet. You can have a chapati with a little vegetable, with your dal, with your yogurt, right? So that's your full meal that you're looking at in the Indian context. So that's important.
So I completely agree with that, because I think it's so important for calcium as well, calcium and vitamin D. So can soya be taken post-treatment? Again, I think we've talked about this. What is your take, Shubham, especially for our ladies with ER positive breast cancer? There's a lot of stuff on internet that don't take this, don't take that. So what is your take?
Right. So, as you know, the data, when you look at, soy, when people they look at isoflavones, that's what the component is that they saw. Maybe that can be estrogenic. So, we are trying to decrease estrogen in the body, but really the current therapies that we have, tamoxifen or aromatase inhibitors, they really take out so much estrogen from the body. These small changes are not going to, unless you're taking soy for breakfast, lunch, dinner in like ginormous quantities. There's no data saying it has worse outcomes essentially that women who take soy as part of the daily diet. Also, the weird thing is that what they've seen is sometimes it can be protective. So that sounds, people are like, how can that be protective? But sometimes, and again, it's all in the data, right? How you look at it is you sometimes that isoflavones can actually take the estrogen out of the site, out of the binding pocket essentially, and decrease the estrogen on the tumor. But that's another different, that's another whole different, hour of discussion, right? But the short answer to that is, yes, so it does get a bad rap, all over. But really in survivorship, when you're taking tamoxifen or aromatase inhibitors or something, if you have estrogen positive tumor, then you really, if you're taking soy as a part of your diet, there's really no data to say that patients have worse outcomes when they do that. And people have looked at it because this is a very, very common question. And I remember I was doing my fellowship, I did a lot of breast cancer clinic, and after that, and this was one of the biggest questions we also talked about.
Yes. So yeah, I agree with that. Is breast cancer inheritable? If so, do we have any preventive measures? So yeah, I mean, yes, it is inherited in about less than 5% of patients. And there are a lot of preventive measures that we can talk about. So we did the first support groups that we did was on hereditary breast cancers with Dr. Rajiv Sareen. You could actually see that on the YouTube as well, because it's a 1 hour of discussion that we have done on this. But various preventive measures, I don't know, Shubham, what your experience is, but in UK, we would have quite a few ladies going for, especially those ladies who had the BRCA1 or 2 gene that they had inherited. One could offer risk-reducing removal of the breast or mastectomy, and removal of the ovaries as well, and drugs like tamoxifen. These are preventive measures which one can do and consider in ladies who have a hereditary breast cancer. So do you have any advice here?
Yeah, no, I think you said that very eloquently, Bhavna. Thank you. I don't have nothing else to add, and I would tell your viewer or the one who asked the question to look towards your YouTube channel. I think that's a long, complicated discussion.
Yes.
I think that hour-long discussion that you've had, I think will be really useful. I really don't have anything to add to that.
Thank you. Do you recommend juicing and smoothies with fresh fruits and veggies?
Yeah, so that's a very interesting, so that's all this, one of the things in the book is, again, we need to focus on the mundane in a way, all this is good. I like, sorry, I think I'm getting a lot of.
Can we mute everyone except Sachin? Thank you.
Okay. So just to talk about, short answer is yes. So, but the thing is, again, this is all like couched into, you just have to be careful if it's not being advertised. You know what I'm saying? So juicing sounds really sexy, smoothies and everything. This is good, but what I'm saying is it depends on what I would rather you have the full fruit rather than juice it. But if you can get through the regular juice, if you can get it, that's good. Keep some pulp in it, roughage. That's important. Now, the one which I would avoid is, is just juice that you get out of a box. So the juice that you get out of the box does have a lot of, let's say, sugars in it and everything. And, those ones are really not healthy. If you're looking at juicing, sure, you make your own juices through your own, whatever things you combine, fruits, oranges, whatever the way you want to juice, that's fine. But, eating the fruit, best. Juicing, good second alternative. Drinking a juice out of a box, of a processed juice out of a box, I would recommend that.
Yeah.
So those are the kind of different things that you can do.
I think I would agree. So what I tend to do is I try, and I can't eat a lot of greens. So what I do is, you have these NutriBullet things, which you put the whole stuff in and you don't lose the fiber. So
Yeah.
basically, you're not juicing it. You're not taking the juice out, but you are actually, mixing it so thin and fine that you eat all of it. So,
I think it's fantastic. Yeah, I would definitely agree. We have one of those also.
Yeah.
So we have one of these also. So I think that's a really good way of just putting all of it together and keeping those nutrients locked into that whatever mixer you use and everything. And nowadays they're like industrial grade, high grade mixers that can chop up anything or juice anything.
Yes.
So I think that should be fine. I think that's healthy.
Yeah. Don't throw the fiber away. That's very, very.
I know,
yeah. So the next question is, I think this applies to not just breast cancer, but a lot of our patients, diabetes. And I would say about 50 to 60% of ladies that I see in India do have diabetes as a comorbidity. So diabetes and chemo together are very difficult to manage because the steroids itself raise the sugars. So any advice on managing these together? I think sugar control is very, very important.
Yeah. So I think, that's a tough one. We also deal with it a lot. A lot of our patients are diabetics, and then we as physicians maybe make it a little bit worse because we are trying to do the right thing by giving steroids to decrease the chance of nausea, but obviously it can lead to all these. In this, you just have to be very strict with your diet, and in a way, just watching what you eat. There's really no easy way out of that. Is if you're a diabetic, unfortunately your sugars will go up. Now they normally go up for the day and the day after chemotherapy, especially for breast cancer. When you're giving steroids for like a day or a couple of days after chemo, that's when they really go up. So that's when you really have to be cautious about what you're eating, and then you just have to manage your take your blood sugars a little bit more frequently. Type 1 diabetics are different because they do it all the time, or people who are insulin dependent, they kind of try to follow their sugars all the time. It comes into patients who are type 2 diabetics, and they kind of they do check their sugars and everything, and I'm not generalizing, but some do and some don't do it as many times a day. But maybe for those 2 or 3 days, you just have to be extra cautious. But it's day 1, 2, and 3. Day 1 being the day of your chemo, when you get the chemotherapy, and normally we give IV steroids at that time. And then 2 and 3 sometimes for delayed nausea, as you're saying, for delayed vomiting, we give oral steroids. And those are the big days that your sugars will spike up, and you just have to be extra careful.
Yes, thank you, Shubham. So one more question. We have a lot of questions. I'm just trying to. It's difficult to walk and exercise because of joint pains. I think you're on hormone therapy because of ER-positive hormone therapy. Is it harmful to walk with severe knee pain? What to do? I think. What do you say, Shubham?
I think it depends on why you are having the knee pain. I think if it's a degenerative disease, that means the knees are, degenerated. That means they've ground on too much each other. And, that's different. That's more of an orthopedic problem. Now, if your knees are okay, you've got x-rays of your knees and everything, they're okay. And it's more because of joint pains and everything. You can try, light exercising and everything. Some people try biking, you don't have to walk. Some people try like a little bit of a slow biking and everything. Again, people may not have access to this, but some people find swimming, really, or like just water exercises when they're standing in the water, those slow exercises, better on the joints. So you can always find something which is better on your joints than, walking or running. That means there's some other resistance exercises you can do. And I'm not saying everybody has access to that, but those are some of the things that can be done, especially, something which is not bad on the joints. It's again, these water exercises that are talked about. Again, people may not people may not have access to them and everything. That's different. But again, you can try something like light biking and everything, just slow, which is not bad on the joint. So try to maybe find something which is not that bad in the joint, and go and, nowadays, gyms are proliferate everywhere. Try to find somebody who kind of, is just maybe you could have one session in which somebody could lay out a plan for you, an exercise plan for you, say, these things you can do slowly, so that it doesn't hurt your joints. But it really depends on why the joints are hurting, and that needs more of a medical workup. Then then we can kind of comment here. But those are the big things. It's basically why it's hurting. If your joints are perfect, there's no problem with them, then you can try to find another maybe exercise which is not that doesn't shock the joint so much. But Bhavna, I'm sorry I interrupted you, and I'll let you chime in.
No, I agree with you. The only thing is I was going to say is that the most of our treatments that we give usually causes pains in the small joints, not in the large joints and ankle or knee. But we've had patients who would have, but it would be symmetric in both the knees. But like exactly what you've said, one needs to address why the pain is there, and then take it from there, because that needs to be addressed. So from Ina, I'm lactose intolerant and on hormone therapy. What supplement in my diet should I do to gain the energy we get from dairy? So you give your take, then I'll give my take as well.
No, I think it's just there's a number of lactose-free alternatives out there, and that's what I would kind of recommend. But you go ahead, Bhavna. And mine is a short answer.
I would suggest things like almond milk or coconut milk, or almond milk is, I make it at home. It's very easy to do. You soak the almonds and take the milk out, and so there are a lot of other alternatives available outside. But so I'm very pro not using preservatives. So try and do, if you can, if you're not working. I'm working, but I still, on a Sunday or a Saturday, I would try and do these things, because it's important to try and eat food which is not processed. Would you agree with that, Shubham? To try and eat everything fresh. I think Anjali said that as well she's one of your patients in your book as well.
That's right. And then, the thing is, we recognize, and, that it's, easier said than done. You're right. It needs an effort, but, everything needs an effort. You have to take that time out, unfortunately. When it comes to like diet and, nutrition, there's really no shortcuts, unfortunately. Doesn't mean you can't have anything processed, or, everything has to be fresh and cooked and everything, but as much as you can do, and we get it that everybody has busy lives and, a lot of commitments and things. So, so it's anything that you can do, but try to, there's data out there saying, there's a book out there called, I think, Cook or Cooked and Everything. It just means, what it tells you is you can never get better nutrition than home cooked food. So that means, I'm not saying anything against restaurants. I like going to restaurants and eating out and everything, but it's obviously what you can do, what you eat there is not the same what you can cook. So there's no way that can supplement what you're doing at home. So that's very, very important, I think so. For trying to really try to do things to kind of cook at home, or just as much as you can do to know what's going inside your food. That's important, rather than from outside. But whatever you can do, it doesn't need to be all the time 24/7. Whatever you can do without stressing yourself out is important. So we don't want to put an extra burden on you. We're just saying that if these are some of the tips, and you can try to incorporate them as much as you can, and if you can't do it all the time, that's fine too. But just be cognizant of what you're really putting inside your body. That's important.
Yes, absolutely. So is weight gain a common side effect of tamoxifen, ER positive, early breast cancer? I'm trying to control diet as much as possible in addition to taking a daily 1-hour walk. What else would you suggest?
I think they're doing everything right. It is, part of it is obviously the hormonal changes which go on from everything, from therapy and then from tamoxifen. So I think the person who's asked the question is doing everything. Is everything, they're doing everything well. So I would recommend they keep on doing what they're doing. I think, I think that's important.
Yeah, I think you're doing the best you can. 1 hour is great for walking, and tamoxifen can cause weight gain, but persevere with your walking and diet. I think diet is very important. So breathing exercise is beneficial. Yes, I think pranayama is very useful. Then does fasting help after completing treatment? Means no carbohydrates, but fruits only once in 15 days. Do you want to take that? And you could talk about intermittent fasting as well.
Yeah,
fasting
that's a whole year. So Bhavna, the other thing, I don't want to interrupt you, but I don't want to take the whole hour. I know you had another guest on. So, I'm happy to,
No,
step off after
you
this
are
if
our
you're
guest.
okay.
No, you are
Okay.
our guest till 7 p.m. if that's okay with
Okay.
you.
That's
We'll
okay.
stop
That's
at
absolutely
7
fine.
because, I don't think one can talk for so long. So we'll stop at
That's okay.
7.
I just want to be cognizant of the time, not hog up the whole time.
No, no,
But
because Sona is
so
yeah. So we kind of
uh,
moderate together, but she's not here today.
wonderful,
Yeah, yeah.
wonderful, wonderful. So I think what we can say is, yeah, yes. So fasting comes in different things. So that's all. There are different ways to diet. So from 20 years back, people started with don't eat this, don't eat that. Now we have thousands of diet out there, right? 10-day diet, 7-day diet, water diet, food diet, fruit diet. I just can't even keep up with them. There's so many of them. Keto diet. The biggest thing is obviously fasting. So we do talk about fasting in the book because one of the big things is intermittent fasting. I tried it for a couple of months. I try to, practice what I preach. So I try to do it myself. I was moderately successful in it. I think so. Did not lose much weight, which is okay, maybe because I was just not eating the right things I should have eaten in those 8 hours that I'm not fasting. But I think, again, some of these diets can be really extreme. So you've got to be very careful about the extreme diets. I'll tell you some of the simple things that are there. One is, yes, a low carb lifestyle is always, I think that's good. I think it really does help. And I'm a good example of it. I tried doing it, starting it in my mid to late 30s and everything. And I think I saw the benefits of it as far as just general overall health. And what I could do. So I think that's so low carb is important. The other thing is, when I was growing up, I remember Star movies was a new thing which had come up cable. My parents couldn't pull me off cable television. Uh, so my dad never thought I would make a physician because he thought I saw so much television. But I think that's every parent with every kid who's growing up. Why I'm saying that is because they used to have a movie which used to come at 9:40 or 9 or 9:40 at night, and then my mom used to call me for food. Shubham, khana khane lage aa jao. Tum abhi tak nahi aaye, TV dekhte rehte ho, So, but that what I'm trying to say is Indians, we eat late, right? So we finish the day, then we come back home, then we have our like snack, samosa, chai ke saath, we take something. And then, kind of it's changed obviously, but I'm talking about 90s, 2000, but still some of it has remained the same. Then we eat late, right? Then we go, okay, I'm going to go to that party. Obviously, pandemic is different, but when it starts, yeah, I'm going to go to that party at like 10 at night, eat at 10, 11, then sleep right after that. I think that's unhealthy in a way. So if you can eat early and then give it a time before you sleep, at least on the days you're not, maybe on the weekdays or something that you don't have a social commitment, which a lot of us now don't do. But try to eat early and try to give your body a little bit of a rest. Just like with everything, that snacking at night. I used to do that all the time. I was working at night, snack, and that's the weakest time. The evening and the night is weakest time. In the morning we're all ready and we're good. But I think it's very important. You can do these simple things, right? So you give your body a little bit of a time to just relax. Try to eat early. Try to keep on. Try to eat low carb and like I said in our last session is, there's a saying called the 100 roads to Dublin. So whichever way you get to weight loss is okay. The extreme diets I'm not really fond of, but whatever gets you to that weight loss, the important thing when you look at the data behind survivorship and food and improved outcomes is weight loss. There's a constant theme out there essentially. People have said, take this out, eat low carb, eat this, and they've said, they've made their own assumptions and their conclusions based on that. But the big thing is who lost weight, losing weight is a big thing. Like keeping a weight under, maintaining a weight is a big thing essentially, and a healthy weight. You don't need to be cachectic. You don't need to be like skin and bones. You don't need to be, we're not auditioning for a Bollywood movie here. We're just trying to stay healthy. So it's very important that you remember that part. I think health also in the Western sense and now in the Indian sense has somehow that having a good body, six pack or, having those muscles or something, I think that's equated with being healthy. That's not the same. I think just keeping a regular weight and everything. In America, we call it the dad bod. That means you can be a dad. You can, you don't need to be overtly obese. But, I'm a dad of 2 girls, but the main thing is that you really need to just eat healthy. And that's the hardest thing to do. Just eating healthy is the hardest thing to do. We all want that easy fix. I'm going to make this juice and lose weight from that, right? I mean, juicing is okay. People use that as a weight loss, but they do that for 2 weeks and they forget about it. So you need to do something, this is a marathon, this is not a 100-meter dash. So you really need to do something a little bit that you can do every day, and something you can incorporate as a lifestyle change, not just a quick diet change essentially. So that's important. So whichever way you get to it, I'm fine with that. You should basically get to a healthy weight. That's the important part. Now, whatever fancy diet or, you take is, I can't comment on that because there's so many. If you start doing that, that would take up most of our day and night just reading about them. But that's a long-winded way of saying, that just keeping a healthy weight is important. Whichever way you get to a healthy weight, I'm not so concerned about that, other than if you do something extreme, which is really, punishing your body essentially.
So, Shubham, there are a lot of that was very, very nicely said, but there are a lot of questions privately to me as well, direct messages about, that a lot of ladies have tried losing weight. They've done the first 400, 500, half a kilo, but then it's static. And, it's the same with me as well. I've been trying during this COVID time, I've put on weight and then, it's static. I've lost about half a kilo. And then, it's not moving. And, it's, I don't know why that is. So you've lost a lot of weight. Your book tells you lost about 20 kilos in according
20
to the
pounds. So I lost about 10, I lost close to, I think, 10 kilos and everything. But you have to realize, Bhavna, that time when I tried to do it now, I couldn't do it. Well, the thing is the initial, when you can do it. So I lost initially and then I maintained at a steady. So what happened initially, your body, if you're not used to working out or not used to doing anything, so your body gets into a shock essentially. So what I did was, my big thing was I didn't realize, but I used to drink like a cola every day, or whatever kind of cola, I've forgotten what. And, that has like one can of cola has 32 grams of sugar, right? So I was eating a lot of hidden sugars, a lot of ketchup in my food, a lot of breads, things like that and everything. So I've actually, what I've done is my lifestyle, what I used to do it is I follow not super strictly, but mostly like a more low carb lifestyle. I try to, I know it's easier said than done, but I try to get out to the gym at least 3 times a week. Try to make time for that. So last week, I was on inpatient. I had to go to the hospital at weird hours of this thing. But so I try to go to the gym at 6 in the morning versus late. Early start to the day. So you really have to carve out that time. I know it's easier said than done, and I don't mean to be over prescriptive or tell people, this is, it's not easy. I hate getting up in the morning. It seems like weird for doctors but I hate getting up in the morning. But I just have to I've realized just dragging myself out of the bed and getting to a gym is good. Once I get to the gym, I'm good. I kind of have, there's an energy, I kind of do that. And again, in the pandemic, I made a little home gym in the back, but getting out and getting there is hard. But once I get there, it's good. And then sometimes it is good to have, put that, if you can afford it, to put that, to get somebody who knows, like a trainer or something who can keep you, who can keep you motivated essentially at least a couple of times a week is important. I think, we do a lot of things ourselves. I think in that, having a kind of a coach or something to guide you along, or a mentor, just like, we are for our patients and everything, I think really did help me. But I can tell you, it can be very challenging, but you just, when you hit that wall, you need a little bit of help, maybe, a nutritionist that you trust, or somebody who keeps you,
motivated.
It's not so much motivated. It's basically about, or like looks at you in a week's time, says, ye kya hua, did you really eat what all I said, or what are your cheat days, or what happened here and everything. So it's somebody who can keep you honest towards yourself is important. If you can't, so I think in life, I'm a big believer in having like a coach, whether people have, people call it any spiritual, you can have a spiritual guru, you can have a life coach, people like fancy names for it and everything, or just a trainer, or just somebody who like keeps you honest. Again, it's all based on affordability and everything. But I think instead of driving that fancy car, I would rather spend that money. That's my thought. I drive a beaten up minivan, so but I do spend money on fitness. I do have a trainer that I pay for. I could buy a really fancy car based on that, but I think it's about priorities in life. I think our human body is like a machine, right? So you really have to take care of it. Otherwise the parts rot out and junk out and everything. So, again, not everybody can have that affordability. I don't mean, mean to say it's easy, but I think if you can use that, takes a little sort of budget out if you can, and use it towards that, use it towards giving it towards your health. That's good, because again, prevention is definitely better than cure. We never remember our prevention. We spend money on all kinds of things, fancy vacations, fancy cars, fancy shoes, fancy bags, but we never spend money on our health. When we spend money on our health, we always are fairly sad about it, and then when the bills come, they come all together. So I think kind of this, I am a true believer in prevention is better than cure. It's easier said than done. You really have to make an attempt to do it. So that's what I've done. I couldn't keep myself honest. I couldn't get out of and go to the gym. So I said, you know what, I'm going to try to, I'm going to drive my, Honda, and I'm going to, find a trainer, pay for a trainer who like looks at me every week and says, have you been doing what I've told you? And I go, oh my God, I need to be, and who keeps on weighing me. So it kind of keeps me on my toes a little bit.
So I think you've said two very, very important things, Shubham. One is discipline. I think discipline in exercise, discipline in diet, in what we eat. And the second thing is take help, whatever help, whoever keeps you in line or in check or grounded. I think that these are the two very, very important things that I think if we do, we slip. I slip sometimes.
I slip all the time, Bhavna. So, but the thing is, it's also important, like a buddy system. It's like a buddy system is very important. I think we talked about in the book is that if you have your, spouse, if your wife or husband, also gets in with you, I think that really creates that time that you can spend together. Maybe, if you do that walk together, go to the gym together, it can, when you're busy, with just 1,000 things in life, maybe that can help, or a friend, or anybody, or like
or a patient,
in a group or whatever.
From a support
or
group.
Another patient and everything support group. We have stories of Niti and Shruti, who kind of form the support group together, who are each other's rocks, going through therapy, just to find a buddy, somebody else. It doesn't need to be like a trainer, but somebody else who keeps you honest. That's what I meant. Your friend, family member, whoever, that you can say, you know what, we both are going to do this walk every morning. So if I don't show up, if I'm feeling this thing, you pull me out of bed. And if you don't show up, I'm going to pull you out of bed. That's important.
Absolutely. Thank you so much, Shubham. This is so wonderful, getting a lot of messages. So what about red wine? So do you talk about wine in your book?
That's a controversial topic. So I don't talk about that a lot, because again, the data is out there. So red wine,
it's not food.
Again, yes.
Not food
yes. It's foodish, I would say. So all I'm going to say about that is the data in red wine is more towards overall health and well-being and cardiovascular improvement. When you really look at the data, I can tell you when you look at the oncology literature, they say, well, any amount of alcohol is not good, essentially. So, but again, everything in moderation. The issue though is, and I learned so many things from my patients about like 7-8 years back, one of my patients was, he was like, doc, can I just have some, just have a glass of red wine? And I enjoy it in the evenings, and it's so stressful. And, can I just carry on? And I said, in a naivety, I said, you know what, that's fine. Just moderation, take a couple of glasses on the weekends or something. And like a month back, the wife came really angry, left a bunch of messages, and she came really angry. And she said, he's drinking the whole bottle, right? So, the thing is also, on what you really have to be careful about what you say and couch it in that you really have to know. It's just hard when you have that one glass, people just say, hey, I'm going to have just one more glass. Maybe it's not going to matter. And that's when we run into issues. But when the data is really complicated, when you look at overall health, cardiovascular, and that also depends on what they say is more people who drink red wines, maybe they're more fit in a way. They look at the diet and other parts of their, of their well-being a little bit more seriously in a way. So, because, so it's not just red wine alone. It's what you're doing also. People who drink red wines are overall maybe more healthy, work out more. So, all those factors, what we call as biases, when we print, when we write papers, we say, these are the biases. Essentially, those biases come into play essentially. But for cancer, the data is, the data essentially says that any amount of alcohol can cause, can increase your risk of cancer.
Yeah, absolutely. I agree with that. There is a question about what type of food increases TLC during chemotherapy. So I have quite a few patients, actually, some of them do take the papaya capsules, or they juice the papaya leaf to increase their platelet count and TLC. I have no views on it. But Shubham, do you have anything to say
Yeah,
on?
a lot of, at least for the TLC, when you're looking at lymphocyte count, that's very, it's hard that you can do that with foodstuffs. There are medicines though you can talk to your oncologist, that you can do, that you can take to increase your white count. If you need that TLC essentially increase because it's being pulled down because of chemotherapy. Again, TLC is a complicated thing. It's not that easily fixed with food essentially, because it's just human bodies, when we look at a lot of data also, it's in mice. So a lot of people quote data from mice. This happened, and human body is not mice. It's very complicated. So for TLC, you really, it's a little bit harder essentially. More is therapeutic, like more is medicines, and there are shots that can be given to increase the TLC. That's the easiest way and the best way, I think so.
And I think the last question, Shubham, is what is the link between food and the feeling of gratitude for being able to have food at our table? I think there's a huge link.
Yeah, I think that's a philosophical question, which is there. So I really think, and I'm going to give a philosophical answer because that's a philosophical question. So, so as you know, I practice in Houston. It's the southern part in the US. It's very religious. A lot of nations are very deeply religious. They, deeply intertwined with their faith, just like a lot of people are in India. Which is very personal. I'm not talking about religion as a whole. I'm talking about faith. A lot of people have faith, and a lot of patients, they tell me, they're like, you're okay, doc, but I believe in a higher being, and and I have that, faith, that, and I say, what I tell them is, modern medicine and faith are not antagonistic. We're not fighting, though it may seem like, you can do both. I think they're synergistic. That means you can do both essentially. You can be spiritual and get chemotherapy. You don't need to do one or the other. You don't need to say, oh, chemotherapy is evil, I'm going to pray my way out of this cancer and everything. You can do both. You can do your prayer. I do a prayer every night before I sleep with my daughter. That's just personal. Faith and religion, faith is personal to me. I do a prayer every night before I sleep and everything. I just thank God for everything I have. It's not a complicated prayer. I just go, I'm alive. Thank you. I'm doing, that's what oncology gives you, that perspective, right, Bhavna? I mean, we see so many patients, there's so many tough times on their life. It just gives you a different perspective. And I talk about that in the book a little bit. But the main thing is these things are not antagonistic. I think you can be spiritual, you can have deep faith, you can have prayer, and you can have therapy all together. They can be, as we said, synergistic. They can help each other. They don't need to be antagonistic. It's not science is not pitted against faith. I think that's kind of, people try to do that just to, divide in a way. I think so. But I think the philosophical part of it is I talk to patients day in and day out in the States also. I say, I'm glad you have a deep faith, do that, keep your prayers up. They say a lot of people are praying for us in church or, wherever they go. And I go, that's great. Keep those prayers up. We'll keep our efforts up, and we both, we are synergistic. And I think that's the main thing. So we don't need to. There's no fight here. We're all working towards making somebody better. We're all working towards a common goal of helping our patients. That's all we're trying to do. And whichever way you do that is good. And all this can be done together. So that's, like I said, again, it's a piece of the puzzle. So it doesn't need to be antagonistic, but. Again, that was a really philosophical roundabout way of giving that answer, but that's truly what I believe and what I talk to my patients about.
That's wonderful, Shubham. It's such a pleasure to hear you speak, and I'm sure all of us, including our patients, have enjoyed it. Ina sent a beautiful message saying that beautiful and informative session, and she's in the process of reading your book. So I'm giving it as to all my patients. Yeah, because I think food does matter, and we are so grateful that you've written this book, and hopefully we'll have another edition very soon. The recipes in the book are amazing, which I know you've collaborated with Mrs. Menon to do those recipes. Some of them are fantastic. Tamarind rice, turmeric rice, and they're so easy to make. So. Thank you so much, Shubham. Really grateful and really enjoyed it. And so it's mainly discipline, diet, exercise, I think is the key. Thank you.
Just do the simple. All right. Yes. Thank you, Bhavna.
Keep it simple. Yes. Thank you so much.
Have a good evening, Bhavna.
Thank you. Thank you, everyone.